Hi, I'm Dr. Ashish Dutta. I'm a cosmetic surgeon from the Aesthetic Beauty Centre and we work in the northeast of England in Newcastle and Sutherland. Fat transfer is a process where we transfer fat from one part of the body to another. As the aging process continues, there are various parts of the body, for example the face, the breast, the buttocks and many other areas lose fat, thereby giving the look or appearance of a sagging. If we take the fat from one area, we do it with a liposuction process and then we process the fat and then we put it in the area where we want it to stay. Fat transfer can be done in many areas. Primarily, it started off with the face, and then we also found that if we do a liposuction and there is some grooves or divots left, we can fill those up. But we also do fat transfer to the breast, to the buttocks area, to the back of the hands, and of course for facial aging processes. As I explained to you before, the fat transfer is your own fat because we are taking the fat from one part of your body and placing it in another. So the difference is that this fat has to live, obtain new blood supply, that is oxygenation, and of course various nutrients to be able to live. In fillers, you're taking a foreign body, which is a hyaluronic acid or calcium hydroxylapatite or various other fillers that are available, and you're replacing your loss of volume in different parts of the body with these foreign materials. Fat, on the other hand, is your own fat. It is as safe as it gets and it stays for a long time if it can be done properly. The operation involves liposuction, where we take the fat from either the abdomen or the sides or anywhere there is a collection of fat. The amount of fat taken out is minimal. Then we process the fat and we wash it, and then we prepare the fat into very small syringes and we put it with a blunt cannula into the areas we want it to put in. The fat needs to live, so we need to make sure that the suction or the negative pressure that we put on the fat is minimal. I prefer the handheld liposuction processes rather than using the machines for this purpose. There are two types of fat transfer. One is a macro fat transfer and also there is a micro fat transfer. The macro is where the globules are pretty big and that you can use for the face, for the cheeks, for the buttocks and the breast. But for the micro fat is usually liposuction with a very fine cannula, so the particles of fat are very small, and that can be used for lips and nasolabial folds, which is a line that touches between the corner of the nose to the corner of the mouth, and that lasts also a pretty long time. Fat transfer has been performed by thousands of doctors all over the world for a long time. It is the process that has changed over the last few years, and now we put in small pockets of fat rather than putting in large amount of fat in one area. The safety of it is that it's your own fat, that is the patient's own fat, and hence the chance of getting foreign body reactions, swelling, etc., or even granuloma formation where the product that we put in causes a foreign body reaction is very little. So in short, fat transfer is safe because we are using now fat to reconstruct breast after breast cancer, and the NICE, which is the National Institute of Clinical Excellence, has given the go-ahead for fat to be used for those purposes. So that's the main reason why we can use fat for other areas, knowing that it is pretty safe. Fat transfer is taking fat from one part of the body. So of course we have to do a liposuction process. It involves two processes. One, taking the fat out, and then second, putting the fat back in. The other limitation is that these little globules of fat do need to obtain new blood supply. If it fails, particularly when a patient is smoking or drinking or not following the instructions, some of the fat globules may die. So fat transfer limitations are mainly having to repeat the process and of course letting these fat globules live as long as possible. The fat that we are transferring is called autologous fat. That means it's the patient's own fat. When these fat globules survive, they behave as if it is the patient's own fat, and that means it will gain or lose weight as the patient is doing so. As we know, aging process means the fat particles that are already there are going to deteriorate as the age progresses. Similarly, these fat particles will behave exactly the same. The key factor is, if the patient is going to follow all the instructions, not smoke, and of course, aging process is different in everybody. If we take that into account, the fat should live for several years. It is impossible to predict, but it has been known some of the fat particles to live up to 10 or 12 years. But we also must take into account that as the aging process happens, some of the fat will die naturally as the fat is going to behave in other parts of the body.